name is Erica. I'm going to be your nurse today. Can you tell me your name?
Braylon.
Hi, Braylon. Can you tell me how old you are?
16.
All right, very good. Well, today you're in for an abdominal assessment, okay? If you have any questions, just let me know. I'm going to do what we call palpation, which is just touching your abdomen. If at any time you feel any tenderness, just let me know, okay?
Okay.
So I'm going to start off with inspection. I'm going to get eye level, and I'm looking at the contour and shape of your abdomen. I'm looking for color. I'm looking for striae. I'm looking for scars, okay? I'm looking at your umbilicus, which is nice and midline. I don't see any visible pulsations or peristalsis. All right, and now I'm just gonna listen to your bowel sounds, okay? All right. I'm gonna be touching a lot of different spots. It doesn't mean anything is wrong. I'm just listening, okay?
Okay.
All right. Okay. All right, brother. Now I'm gonna listen with the bell side of my stethoscope, which is the small side. And I'm just listening for, I'm gonna be listening for vascular sounds, okay?
Okay.
All right. This is your aortic. Okay. Your renal. Your iliac crest. And your femoral. All right. Any tenderness?
No, ma'am.
Okay. So now I'm going to do some general percussions, okay? Okay. Okay, any tenderness?
No, ma'am.
All right, I'm going to do some light palpations now, okay? All right, any tenderness?
No, ma'am.
Okay, I'm gonna go a little deeper now, okay? All right, any tenderness?
No, ma'am.
Okay, so now I'm going to be listening or looking for some organ swelling. All right, I'm going to get you to put this on to the side for me here, okay? You still doing good? All right, so now I'm going to palpate your liver. I'm going to lift you up here, and I'm going to come down here underneath your rib cage. Take a deep breath for me. All right, any tenderness?
No, ma'am.
Okay, very good. So I'm going to go on the other side. I'm going to do the same thing with your spleen, okay? I'm just going to lift you up here. All right, any tenderness there?
No, ma'am.
All right, very good. Okay, next I'm going to check your kidneys. Any tenderness there?
No, ma'am.
Okay, I'm going to do the other side now. What about there?
No, ma'am.
All right, very good. So now what I'm going to do is call some specialty tests. I'm going to be checking for your gallbladder, which is also called a Murphy's test. Let me get you to take a nice deep breath for me. All right, very good. Any tenderness?
No, ma'am.
Okay. Next, I'm going to check your McBurney's point. I'm going to push in. Any tenderness?
No, ma'am.
What about when I let go?
No, ma'am.
Okay, next I'm gonna do a Bloomberg's test, and I'm gonna push in here. Any tenderness?
No, ma'am.
All right, what about when I let go?
No, ma'am.
Okay, this was checking for an appendicitis. This was also checking for an appendicitis and any rebound pain, okay? All right, The next test I'm gonna do is called an iliopsoas, and it's also checking for appendicitis, okay? All right, so what I'm gonna do here, let me get you to lift your leg. All right, very good. I'm gonna come on the other side and do the same thing. Let me get you to lift your leg. Okay, very good. Any pain or tenderness? Okay, very good. Let me get you to sit up for me, Braylon. Okay, and I'm gonna get you to turn around to this side here. So right now, what I'm gonna be doing, I'm gonna be checking for any for CVA tenderness, okay? And that I'm just gonna be checking your kidneys. Okay. All right. Any tenderness there when I hit? Okay. Any tenderness there when I hit? Okay, let me get you to turn around for me. All right, and that concludes your abdominal assessment. Do you have any questions for me, brother? All right, thank you for coming in. We'll see you next time. All right. Today, I'm going to be giving a verbal report on a 16-year-old male who came in for an abdominal assessment. We started out with inspection at eye level. The abdomen was flat, symmetrical, no masses present without any apparent masses. Skin was smooth, no striae, scars or lesions present. The umbilicus was nice and midline. No visible peristalsis or pulsations. Bowel sounds were present in all 4 quadrants. No vascular sounds or bruits, No vascular sounds or bruits present. Tympany was predominant in all 4 quadrants. Abdomen is soft with no tenderness noted on light palpation. No organomegaly. No masses present with deep palpation. Murphy's sign and McBurney's point for rebound. Blumberg's for referred pain. Blumberg's for referred pain, and the iliopsoas muscle test, all were negative.